Okay, so carrying on page 3 of your slides, I want to refer you to this section of the course, which just backs up that everything that we've written in the course is followed up by science. There's a couple of tests out there. One of the major contributors to that is the American Congress of Obstetricians and Gynecologists. So, moving on to what we like to say, this section of the course, your benefits of exercising during pregnancy. Now, what we want to try and give you guys also is the tools to go out and market the knowledge that you have. So, from that perspective, if you get a new client that comes to you and says, why would I train through my pregnancy? I'm a little bit scared. There is still that notion in the industry to wrap yourself up in cotton wool, so what we want to try and do is get that out of their mindset. So starting with the first one, first benefit of exercising during pregnancy is maintaining a healthy weight gain. Obviously, a pregnant female's goal during pregnancy is not to lose weight. Unfortunately, they may come to you and ask for that, but it's not likely to happen. So, what we want to do is maintain a healthy weight gain. The average weight gain of a female during pregnancy is roughly 20% of their pre-pregnancy weight. Now, if you go off an average of a 60 kilogram female, you're looking at around 10 to 12 kilos. With 10 to 12 kilos, that is not all the size of the baby. Baby does not weigh 10 to 12 kilos. We've got a little breakdown here for you as well. So you can see, so the baby roughly between 3 to 4 kilos. Other stores such as fat stores, amniotic fluid, breasts obviously 1.5 kilos. So this has gone off the average of 10 to 12 kilos. So what you're looking to do is reassure your client that it's okay to put on weight, but you want to maintain a healthy weight gain throughout. The next one, and one of the most important ones, we really focus on this on the course because it is so important, is strengthening your pelvic floor. So studies show that 1 in 3 females roughly suffer from some form of incontinence at some stage during their pregnancy. It's not a particularly, it's quite an embarrassing topic for clients to talk about. So what you want to stress to the female is the stronger their pelvic floor, the less chance they're going to get of incontinence, suffering from incontinence during their pregnancy. We'll talk about pelvic floor later on in the course in a bit more detail. The third benefit of exercising during pregnancy is to improve your mood and prevent pre- and postnatal depression. Now, they say again that postnatal depression affects roughly 80% of mothers. Just from my experience, obviously we can't talk about it as we've got to stick within guidelines, but from my experience it's probably a little bit higher. It's a pretty tough topic to talk about once again, but as you guys know as personal trainers, exercising and eating right does release the feel-good hormones, as they call it, and again that increases if you're exercising throughout pregnancy. They recommend that you exercise 30 minutes a day, 5 days a week, without any complications. The next benefit of exercising during pregnancy is to help prepare yourself for labour and decrease the length of labour. Now there's a study by Dr. James Clapp. He did a study of 500 women, and he found that of those 500 women, those exercised regularly throughout the pregnancy, their labour time was reduced by up to 1/3, with 65% of those women delivering their babies in 4 hours or less. Now, if you can reiterate that to their client, particularly for the second and third time mums, they understand that labour is a tough period in their life, and the shorter they can get it, the better. Decrease the incidence of back pain, pretty important one for this course. We find that back pain is one of the most common pains during pregnancy. Now that's due to the changes that are essentially going on in the mother throughout her pregnancy as she gets later and later on through the trimesters. Her uterus begins to grow. Postural changes such as kyphosis, where her shoulders roll forward, and lordosis as well, so it's creating the arch in the lumbar spine, obviously can cause back pain. Now, The other thing to bear in mind, as the uterus grows, the rectus abdominis actually becomes misshapen and it's not functioning properly. So essentially their core is compromised. So the load, the mother's load of extra weight as well, because she's got extra fat stores and the uterus is growing, has to go somewhere. Generally it will go to the lower back. So what we're trying to do is work around that. And we'll talk about that later in the course of how to do that. So, exercising during pregnancy may help to prevent preeclampsia. Now, sometimes, of course, preeclampsia can be hereditary, but if they do suffer from blood pressure issues, as we know, once again, as personal trainers, exercising and the right nutrition, it does help prevent preeclampsia. Same with gestational diabetes. It's becoming more and more common, as studies show. It can lead to the baby developing type 2 diabetes after birth. Again, this is more of a nutritional and lifestyle factor, which obviously as personal trainers we need to be careful that we don't go outside the scope of practice. So you can reiterate to your clients that exercising and the right nutrition may help prevent GD, but you must reiterate to them that that is something they need to refer out to if they are suffering symptoms. And on this slide we've got the general benefits of exercising. Increasing energy levels. You'll find particularly in the first trimester that your clients will be tired, they'll be fatigued. So this is a real great benefit for those of them that know and are feeling that at the time. Healthier sleeping patterns, as they say, ideally everyone would get between 7 or 8 hours sleep a night. The mothers out there that we have know they don't generally get that, particularly with a newborn. So if you can reiterate to them that exercising during their pregnancy will help their sleep patterns, and they're going to get those 7-8 hours of sleep beforehand, because they're not going to get it afterwards. Again, it's a really quite a major benefit for them. Improving circulation. We'll talk about a few issues of circulation later on in the course, but varicose veins is quite a crucial one, and it does happen quite often. So if we can improve circulation to the extremities, hands, feet, and so on and so forth, again we can reduce the chances of those happening. So this part of the course, what we have to make sure that you remember is that the exercise is not safe for every pregnant female. Okay. Again, what we say is backed up by the medical science that we showed you earlier. It is safe for most pregnant females under normal circumstances without complications to exercise 30 minutes a day, 5 times a week, and that's recommended. Okay. What I would say, the most important thing to note with this slide is that you should always get doctor's approval or doctor's clearance before training a pregnant mum and a postnatal female. So what we want to do as well is just highlight to you guys a few contraindications to exercise. So as I said, it's not safe for every pregnant female to train. So I'll just highlight a few for you, as we don't want to go through all of them in detail. Placenta previa here. Placenta previa is where the placenta moves out of its unnatural position, and it can move into the birthing canal. Now, once again, as personal trainers, this is not something we need to know in great detail, but we need to find out the severity of it. If, for example, you take on a new client, they fill out a pre-exercise questionnaire, and they go into detail and they mention they've got placenta previa, you need to find out the severity of it. Again, you need to refer back to their gynecologist, obstetrician, midwife, whoever it may be, about the severity of the placenta previa, as it can affect their exercise regime. Now, that's why it is also under relative contraindications and not under the absolute contraindications, because depending on the severity of the placenta previa, depends on whether they can train. A history of sedentary lifestyle. Now, this one is quite important to find out more details. So, we would say after roughly week 20, 22 of their pregnancy, if they haven't been through a resistance training program prior to coming to you, we would say it's probably too unsafe to now start that kind of a program. It's their body's already under a new stress, a new strain, particularly for the first time mum, that the body's not used to. Putting it under that extra stress of a resistance program that they've never done before, it can cause it could cause health issues, not benefits in a sense. It's once again, you've got to find out more details, and that's again why it's under a relative contraindications. Multiple pregnancies here. Obviously, there are risks that can occur with twins, triplets, and so on. The mother, if they are carrying twins and triplets, again, are going to be larger, a little bit heavier, so it's an extra stress on the system. The mother's trying to nurse 2 or potentially 3 fetus, so it's a case of finding out more details and if there are any sort of health issues that are associated with it. Now, under the absolute contraindications here, so these are scenarios that you shouldn't really train any pregnant female under. Again, these will be highlighted hopefully in your pre-exercise questionnaire. So what we've got here is multiple miscarriages. We'll just highlight this one. If you have a client that's come to you and they've had 3 miscarriages in a row, then under no circumstances should you train them. Going back to what I mentioned earlier, again, it's an extra stress on the system, a resistance program that the mother cannot handle. She's already struggling to deal with the pregnancy as it is, and that's highlighted by having 3 miscarriages. So if they have 2 miscarriages, then there's still a chance you can train them, but again, get more details and make sure you get that doctor's clearance. Those are the ones that we'll just go through in a bit more detail. Obviously, as I mentioned there a couple of times, the pre-exercise questionnaire is so important, and it will go into more detail for this for you, but just so that you're aware of some of them that are highlighted by the guidelines. What we've got here are scenarios that may happen in the middle of your training session that you should stop the session immediately. Okay. Now, a lot of these, if you had a normal client, like a weight loss client or a fat loss client, you would be a little bit concerned that they were happening. I mean, if you're talking difficulty in walking, headache, dizziness, or faintness, chances are you would say to your client, maybe let's give it a rest now. We'll come back when you're feeling fitter and healthier. Now, it's even more of a risk for a mother, for a pregnant female. And then, of course, you've got the pregnancy-related ones. Any vaginal bleeding or fluid loss, that's a massive red flag. You should send them straight to the hospital. Deep back or pubic pain, again, can be quite common. It's not worth pushing them in a sense. And as I mentioned there, the usual health risks, unusual breathlessness, any sudden swelling of the hands, feet and ankles. Essentially what you're looking for here is if the mother, if your pregnant client comes to you and says, I'm not feeling great today, or I've just got a bit dizzy from that exercise, we recommend that you stop training. Okay. That's just what we want to highlight to you with this slide. One of the most important topics in this course is obviously how to train your client safely, and what you want to make sure you avoid if you're training your pregnant female is not to get their body temperature above 39.5 degrees centigrade. Now that can be harmful if they do go above that temperature to the mother and to the baby. Of course, it is hard to gauge. You're not going to have a thermometer with you, I'd imagine, most of the time. But what we would say on this section is just common sense. What we would recommend is if you are, you've had your client, you've been training with you for a couple of years and they are quite fit and healthy, so you kind of know their parameters, I would say take it back a notch, even if they are one of your fitter clients. So for example, prolonged intense exercise, we'd say nothing more than 15 minutes of prolonged intense exercise. So making sure that we reiterate that there's plenty of breaks, rest periods, plenty of time for them to get fluids on board. That's just reiterating the point that you don't want them to overheat, get plenty of waters on board. And once again, we mentioned that in hydration, there's an extra 500 millilitres required by the body for every 30 minutes of exercise. So make sure you're being stringent with this. Sometimes you can, with a fat loss client, you can get away with it and pull back a little bit. But with this one, really important that they get that hydration. Avoid exercising on hot or humid days, particularly if you're training your clients outside. If you are in the gym, be sensible with it, train near the fans, in the aircon room. You just don't want to put them under too much stress. And of course, you should know, if your clients don't already know, during pregnancy they shouldn't be going into saunas, any hot yoga. If your clients are into that, now is the time to pull them away. Now, with the pre-exercise questionnaire, we won't go into it in too much detail, but obviously, as I mentioned previously, with the contraindications to exercise on the previous couple of slides, those should probably all be on your pre-exercise questionnaire. The more in-depth your pre-exercise questionnaire, the better. It's essential that you get a pre-exercise questionnaire for every single one of your new pregnant clients and postnatally. A couple of things we would say have to be on your pre-exercise questionnaire. Obviously, the medical issues. Some things that we recommend to be on your pre-exercise questionnaire is emergency details. With the emergency details, we also recommend that you get the number of your obstetrician and your medical practitioner, not only if there is an emergency and you need to get in contact with them, but to get further details on any of their medical conditions. And also important to talk to these people, as you can get a referral network through these practitioners. So don't be afraid to ring these practitioners and tell them what you're doing. As we mentioned earlier, we want you to take away from this course the skills and tools to build your own business, as well as the guideline knowledge. So get these practitioners' numbers, give them a call, and you could get yourself a new referral network. Okay. Other than that, real important questions to ask is their due date, so you know what trimester they're in. Any previous medical history, so if they have been pregnant before, did they have any issues? If they have been, or if they are a mum, they've given birth before, whether it was a C-section or a natural birth. You want to find out things such as whether they drink alcohol. Obviously, it's recommended during pregnancy that you reduce the amount of alcohol pretty much to zero. One other thing that we found out recently, once again, find out more details on this, but midwives now and obstetricians, if you do have a mother that's fallen pregnant and they're a big smoker, heavy smoker, they won't actually tell them to quit smoking. The reason for that is the stress of quitting smoking can have a negative effect on the mother and therefore the baby. Again, that's outside the guidelines, so do your own research on that one and talk to your healthcare professional, but that's just a side note.